Hey, gang, it is springtime. It's after work time, but more importantly, it is hump day. That means it's happy hour for the dinks, the dentists in the know. This is your backstage look at current trends, politics, and education in the dental world. Though we are live for a change because we had people away, we had things going on, but we're back live. The band is back together again. It's live and it's over a cocktail. I'm Dr. Jeff Horowitz. My co-hosts, as always, are Dr. Chad Duplantis and Dr. Jennifer Bell. And it's a good thing I have the ability to pull them up because they're trying to give me a hard time and not be on the screen. But we are your dentists in the know, and our job is to bring the dental community together by bringing all of you in the know. We have an incredible guest tonight, right? We have a true legend in dentistry, and I'm so excited about our guest tonight. Not just because I've taken so many tidbits from him, but because almost every dentist I know that's good at case presentation and good with case acceptance uses some of this man's principles and some of what he teaches. He's been doing this for a long time. Ladies and gentlemen, how does Conan do it? Paul Homoly is with us today.
Oh, there you
Dr.
go.
Paul Homoly, right? Like Conan would say. Really stoked to have him. This is going to be a great program. Can't wait to see where the conversation goes. But first, JB, it's been a while since we've gotten any news.
But from a news perspective, a couple things. One, I have to remind you all, we have, what is today's date? The 22nd, 23rd.
23rd.
You have 8 days to get your filings done for the HRSA funding. So if you receive second round funding, you have 8 days. I do know that there's additional funding that's open as well. So if you're still needing to supplement and offset some losses and challenges, and frankly, I'll be honest with you, I was looking at our January and February numbers, and it wouldn't surprise me if dentists were having a tough go, just based on what we were seeing. There definitely was a bit of a downtrend again when Omicron kind of had its big spike. And I would imagine that was fairly consistent across the profession. So I don't know that we're completely out of this. And for those practices that were struggling, there is additional funding available. So I would encourage you to take a peek at that. There is open comment period. So OSHA has decided, we talked a little bit about this last time, but it has become official that OSHA has decided it'd like to take its temporary standard for aerosolized matter and turn it into a permanent standard. And as you know, permanent standards that currently exist for us are bloodborne pathogen, hazardous materials. Those are the ones we currently operate under. They would like to add an additional infectious disease standard. There is open comment period. I will post those dates if you have the bandwidth at all to be available. I actually had I have a patient who works for the FDA, pretty high up in like testing and looking at various products and that type of thing. And she said, Jen, let me tell you, please comment. I encourage you to comment, because we were actually specifically talking about the dental implants, because they're very deep in digging into dental implants right now and 3D printing. Those are both on the FDA's radar. And she said, we are required to read every single comment, and we must acknowledge that we've read it and compile that. And if we get enough comments that reflect the same thing, we have to reflect that in our regulation and ruling. So while I know it feels like you're just blowing wind into the open desert, no one's really paying attention to what you have to say, they do look at it, how it impacts decision-making. I don't know, but at least you can say you participated in the process. So OSHA is having open comment period for the infectious disease standard that they are considering moving to a permanent standard. So I'll post those dates that just came out yesterday. So we are really in the know right now, really in the know. A couple other things that Jeff, Chad, any questions about that? Concerns?
None as of yet.
Okay. Keep me posted. The Code Maintenance Committee, which we love talking about in the spring every year, has come up with some updates on their current codes. And the interesting thing here is we've got two things happening simultaneously. We've got our normal code maintenance program that happens every year where all organizations and different players in the dental industry are coming together and submitting requests to change codes. They want to add codes, take away codes, modify codes, etc. Then subsequently, we also have this second group who's looking at a fundamental change in the CDT code makeup, making it look a lot more.
They put the fun in fundamental.
They might have sucked the fun out of fundamental. So we've got these two things happening simultaneously. So this is normal maintenance of the maintenance code. And this is in conjunction, there's the whole revolution of the CDT makeup, which would look a lot more like medical. One of the interesting things is there's been a huge campaign for HPV and HPV vaccines amongst the dental community. Looks like you can now administer HPV vaccines in your office and be reimbursed. There is a code now for that. Will insurance carriers pay for that? Should you be well versed in medical coding? Yes, if you want to do that. But there is a CDT code for that. Jeff, I don't know. This was kind of interesting to me because there were 6 codes added for tomosynthesis. Are you familiar with that at all? Because I felt
tomosynthesis.
Tomosynthesis. It's an emerging intraoral imaging procedure for the capture of a comprehensive radiographic survey.
So it's interesting because they have, as of right now, they have where you can capture an image, and then they have a code for generation of the images. But I didn't know that they were subdividing it even further.
Yeah, I don't know. So there's also 4 new codes to document 3D dental and facial surface scanning procedures. I think that's an interesting change.
Interesting.
Right. And
now I'm in the know.
Aren't you?
Mm-hmm.
There are 2 noteworthy changes that you should note. The D0210 code is no longer specifies the number of images captured for this procedure to be reported. The type and number of images needed for a comprehensive survey is determined by the dentist, which I'd have to go back and actually see what that code was. And then a little bit of modification of the full debridement code as well. So those are nothing actually earth-shattering in that one other than the HPV vaccine reimbursement. And that comes off the heels of pushing for COVID-19 vaccine reimbursements and diagnostics as well. All right, guys, I have one last piece of information and then I'll introduce our speaker for tonight, or our guest.
I have something to say after your one last piece of information. So maybe there's like more people that have things to say besides you. I'm just saying.
I don't even, that can't possibly be true.
Yeah, we could talk.
Mm-hmm. Go ahead, carry on.
You guys are so cranky.
I know there will be peace when you are done.
So there is, I need to dig into this a little bit more, but remember we talked about Medicare and how you could opt in or opt out if you wanted to be a provider or not. And even if you opt out now, I believe, as I understand it, patients can still file for reimbursement, which I think is good for patients. And that was a big win, that even if you yourself are not a Medicare provider, they can still get compensated for their visit. So I'll try to post a more succinct piece of data on that. So if you have Medicare patients that are coming in for procedures like Jeff, for procedures that are related to sleep dentistry, you may be considered on a network for Medicare, but they may still be able to file for reimbursement, which I think actually is a win for both the providers and the patients.
And I'll agree with that because, and I think as we see more changes to Medicare benefits and other parties actually offering Medicare benefits, the Plan Fs, things like that, I can tell you from the sleep medicine side that we're seeing much improved reimbursement from where we used to be when it was just Medicare administering these plans. Now third parties like United Healthcare and Humana and all of these other companies are actually administering Medicare plans. And it's really, it's been a breath of fresh air because we've absolutely had improved reimbursement from Medicare for sleep services.
That's awesome.
Yeah.
Chad, you wanted to say something?
Yeah, kind of. So, thank you for your lovely news. I mean, it's always just
You're
so
welcome.
riveting.
You're
I'm
welcome.
so excited about some of the opportunities that you laid before us. But hey, you don't know this, JB, because we haven't
That
talked to
always
you about
makes me nervous.
this. No, this is good. Jeff and I met with this company in Chicago called Dental Ray. And Jeff, you've been gone, and I had an awesome meeting with Dental Ray today, and you guys started talking about, a little bit about CBCT. Dental Ray is about to shake the world of dentistry in the way of interpreting CBCTs and doing a lot of things with CBCTs and actually providing reimbursement pathways for us dentists through CBCTs. That's basically just plug and play, and we don't have to worry about it. In talking to them today, I realized that my ROI could go up just incredibly for my CBCT and actually get reimbursed for the things that we do rather than just charge what they cost. So keep an eye out for Dental Ray. They're not sponsoring this by any means whatsoever, but we will have them on the show. And I can't tell you how excited I am to have them on the show down the road, because I think there's some really, really big changes coming in CBCTs for dentistry. And I think Dental Ray is kind of leading the way.
So will I finally get my wish, Chad?
Yes.
My wish, when I go to sleep every night and I'm saying my prayers, I always pray that every single dentist in the world will have a CBCT in their office for comprehensive treatment planning. And it's a no-brainer to begin with. And with medical reimbursement that available, that's just going to take any excuse for someone not to have one in their office away.
Yeah, I totally agree. I think this is going to open the doors for so many dentists to really see the power of CBCT and the availability of what we can diagnose and treat. I think it's just going to be so amazing. So we will have them on the show shortly, but I just wanted to throw that teaser out there because I'm excited about a lot of the companies we met with in Chicago, but Dental Ray is just wow. So
yeah.
Did you see that Align is going to start integrating CBCT?
That just makes me even more happy.
Yeah.
Did you see that, Hefe?
I did not.
Yeah.
Well,
there are a couple of aligner companies that have been sort of claiming that that's their differentiating factor, is that they'll integrate a CBCT. And there's so much to be gained from that.
Oh, of course.
So
Totally
I think it's exciting to see that, to your point, Jeff, the little prayer that you pray every night, it also is helpful when the technologies that we're all using every day, whether it's Invisalign or other clear aligners, are supporting the capture of those images and giving us more power with that data. I mean, the data is only as good as what you can apply and do with it, right?
Mm-hmm.
So when you see companies also starting to embrace, who aren't in the CBCT business, but embracing the power of that information, I love it.
I love it too.
Well, why don't you introduce our guest, JB?
Has he been
And
patient?
I'm going to drop out and work on his slides for a second. So y'all go ahead. All right.
Okay. So I was really lucky to be introduced to Dr. Homoly with a good friend of ours, Eric Roman, who I went to dental school with. And he was a guest of our program probably a little over a year ago. And he was very gracious enough to make the contact for me because I've heard of Dr. Homoly. I've seen him speak. I've witnessed the lives that he's changed and impacted in the dental profession. And I thought, this is somebody we need to have on the show and have a really open dialogue about, being a clinician and all the values that he can provide to us in treatment planning and in case acceptance, but also as communicators, because whether he's teaching you how to be a good dental educator or dental speaker, There's a lot of value that comes when you learn how to communicate, whether it's with an audience or with an audience of one being your patient. And so I'm so blessed and excited to have him on tonight, and to share some of his experience with us, and to help, I don't know, shine some pearls and light into our profession. Thank you so much for being with us tonight.
Golf clap.
All right. Big round of applause here. Yeah, thanks so much, JB. You know, we're talking about CBCT, the complex dentistry, aligner orthodontics. Let me ask you guys a question. Let me ask you a question. What's the most difficult thing about complex care dentistry? Is it the technical delivery of the dentistry, or is it influencing the patients to accept care? What's the more difficult path here?
What a great lead-in question, because having done this for 30 years, there is no question that it's the latter. The dentistry is the easiest part of what we do, learning how to do it. It's getting the patients to understand their problem and convincing them that this is something that should not only be important, but valued by them.
Yeah, and absolutely yes. And the whole idea of what do we focus on? You go to the Chicago Midwinter meeting, and there's umpteen programs, and 90% or more of those programs are on how to fix teeth. Yet, how much is invested in helping practitioners become more influential, more interesting communicators with their patients? You see, the culture of dentistry really doesn't want to study influence. We want to educate. We want to educate our patients. We want to tell our patients, here's your problems, and here's how we can fix it. We can do it method 1, method 2, method 3. What do you think? And that problem right there it's the same problem we had 30 or 40 years ago. We still have it today. The big difference is, well, think about this. Imagine it was 30 years ago. 30 years ago, before digital, before cone beam, before aligner. 30 years ago, if a patient came in with severely infected, periodontally infected teeth, and they had to have all of their teeth extracted, what would be the most definitive treatment plan you could offer a patient 30 years ago?
A denture.
A denture. And
Cold
30 years
steel
ago,
and sunshine.
yes, exactly right. And 30 years ago, what would be the total treatment fee for that extraction and the denture, and maybe you do some reline? Where would you be in? Maybe the $1,000 to $1,500 range, maybe about 30 years ago.
Right.
Yeah. Okay. So let's fast forward today. Same patient comes in, full mouth periodontal problem, extract the teeth. What's the most definitive treatment plan you can offer the patient today?
Denture.
Well, implant retained dentures, and
Absolutely yes. And is that a $1,500 treatment plan?
Absolutely not.
No.
Absolutely not. That could be $30,000 or $40,000. And yet, when you go back 30 years ago, the process for treatment acceptance was all based on what the gurus told us at the front of the room. Educate your patients, show them their problems, floss their teeth, let them smell the floss, show them the x-rays, patient educate. And that whole mentality about our role being the educator has not significantly changed in the last 30 years. And what tonight is about is that I want to make a real strong case. And here it goes. I believe that patient education, and we won't use the slides, Chad. Let's just take the slides out of it.
They're there if you need them. You let me know.
Good. No, hey, I appreciate that. While you were working backstage there on the slides, I just decided to kind of shift gears a little bit here.
Okay.
Okay, so
Pivot.
I'm going to make a statement right now. I believe that patient education as a factor of influence is horribly overrated in dentistry. Let me say that again. I believe that patient education is a factor of influence, is horribly overrated in dentistry. I believe the role of patient education is really two things. Number one, patient education is about prevention. How do we help patients take care of the teeth, take care of the dentistry we've provided for them? Second reason for patient education is consent, making sure patients know benefits, risks, and alternatives to care. We as practitioners have used patient education as a way of hopefully influencing patients to accept care. Now, that works pretty well when the cases are modest. When that patient comes in and has, $1,500, $2,000, $2,500 worth of dentistry, you show them their problems, you give them an idea about what you can do, you talk about their insurance a little bit. It's not a big deal, to tell you the truth. They aren't looking for lifetime relationships with patients. Most modest care young patients are looking to get in and get out, and that doesn't make them wrong. However, when the fees get up to 8, 10, 12, 15, 20, $30,000, this whole idea of education begins to lose its impact. And what I'm going to suggest to you is that as those cases get more complex, it's less about educating patients and it's more about understanding patients. And that's the point at which I believe that most dentists need to reach to be able to evolve from modest care dentistry, operative, simple crown and bridge, to more complete care dentistry. The shift is from educating patients to understanding patients. Now, here's where we run into a problem. Let's say you're a mid-career dentist, you've been down the road maybe 5, 8, 10 years. You've been doing bread and butter dentistry. You're pretty successful at it. You run off to the Institute of the Milky Way. You come back armed with CBTCs and implants and all the goodies. And now your treatment plans that you offer are no longer a $1,500 treatment plan, but now they're a $15,000 treatment plan. And yet you try to present the care the same way that you presented the $1,500 plan. My point is that as the case fees go up, our emphasis needs to shift from educating to understanding patients. That's my first point, and I'm just going to pull up right here and get some comments from you guys.
Well, I love that, because a lot of times I'm not doing it all right, but a lot of times when I'm doing those larger treatment plans and I go through because unfortunately there are now with technology, I mean, to your point, if it was 30 years ago and it was extractions and dentures and we were pretty much done, that was the extent of the conversation. Now we have to talk about the 16 different prosthetic devices that I can build on top of implants, or, do all these things and try to get patients to understand that. And at the end of every conversation, I'm like, and now we just have to figure out how to marry what you want, what you can afford, what works, like function and aesthetics. What is it that you ultimately desire with what technology will allow you to have? And then when we find that perfect intersection, then that's your treatment plan. And it's not like, this is why you have perio and this is how you got to this point. And, it's really trying to get all of their goals and aspirations to align with these very complicated treatment plans to ultimately give them something that they can learn to live with. And to your point, risk, benefits, and alternatives.
You know what makes treatment plans complicated, JB?
Us?
We do. We make them complicated. Right. And my skin started to crawl when you started talking about explaining to the patients all the different prosthetic options. Oh man, just shoot yourself.
Yeah. You're not going anywhere.
Just stop that. Stop that. Yeah. We're the doctors. We're in the know. We know what is best in terms of their medical and dental and psychological history. Present that treatment plan. And Paul, that will be a big step.
Yeah, you said two things that really stuck out to me. First of all, great use of the term "in the know." by the way, very nice. Second is understanding, because you, as well as another gentleman named Stephen Covey, had a tremendous impact on me and how I communicate with people. And that was really the first step in becoming a good case presenter, was that term understanding what the patient feels and what they want, which you address beautifully in your four chiefs. I know I'm foreshadowing here, but it's something that really stuck with me, because I've always tried to understand what the patient is wanting and needing, and they're two separate things a lot of the time, which you addressed in your lecture. And I'm like, this is such a perfect marriage, is really just getting to understand them and then dropping all this technical stuff that we get into, because it's hard to teach a dentist how to understand a lot of that stuff. You're certainly not going to teach a layperson in a 10-minute treatment plan about all the different options of implant dentistry.
That's exactly right. You know what I'd like to try here, and I'm just gonna shoot for it right here, Chad. I'm gonna have you role play a patient. Okay,
Okay.
you're gonna be the patient, and I'm gonna be the doctor, and I'm
Okay.
gonna take you through the process of the four chiefs.
All right.
Jeff, you mentioned it earlier. The four chiefs are really the foundation of my work. The four chiefs are, the first chief is chief condition. What is the condition that brings the patient into the dentist? The second chief is called chief disability. The disability is how does that condition interfere in the patient's lifestyle? How does it get in the way? Does it get in the way at work or at home? How does it bother the patient? The third chief is called chief benefit. The behavioral benefit is what the patient seeks. It's always the opposite of the disability. And the fourth chief is the chief fit issue. The chief fit issue is the patient's life circumstance that they're in right now. Do they have kids in college? Are they building a new home? Are they changing jobs? What's going on in the patient's life that we need to accommodate for? Okay, so Chad, I'm going to give you the role.
Okay.
You're a
By the way,
business.
Chad is a great layperson.
All right, excellent, excellent, excellent. Okay, Chad, you are a university professor. You're married. Your wife is a stay-at-home mom. You just had twins. You're looking to leave the university to start your own business.
Okay.
You've had problems with your maxillary anterior teeth for years. University insurance never has been very good. You've got some discolored composites in your front teeth, and it's a little bit of a problem for you. Students forgive you, but you're going to go into the marketplace and you just feel that you need to be shinier and a little bit more confident. Your wife mentioned that to you. Okay? Okay.
Chad,
so,
are you going to bring up your halitosis?
Right.
Yeah.
Okay.
Sorry.
And so what we're going to do is, and don't make this too easy or too hard for me, Chad.
Okay.
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 Let's just kind of play it straight. So first thing that's going to happen is I'm going to know that you're an adult complex care patient before you come into the practice. How do I know that? Because I've trained my team to identify adult complex care patients over the phone. Consequently, I'm able to give you an appointment first thing in the morning or first thing in the afternoon with nothing in my other column. I'm going to have time enough to talk with you. And,
Okay.
and remind me, I've got something for your audience here that
Okay.
will show them how to triage over the phone.
That's awesome.
So it's first thing in the morning. I've got nothing in my other column, Chad. I meet you in the consultation area and we start. Chad, hey, I'm Dr. Paul Homoly. Welcome to the practice. I'm looking at your record and I see that you live on York Road. How long have you lived in that area of town?
About 7 years.
7 years. My brother and his family grew up not far from there. They went to York High School and their kids are really big into baseball. So I understand where you're living. I'm actually on the north side of town. Our kids are off the payroll, and my wife and I, we're enjoying.
Oh no.
I
Oh
think we
no.
lost Paul. Well, he'll be back in a minute. We'll be good.
Let's get him back in a second, I hope.
Yeah, he'll be back. He's just a little bit frozen.
I
You know,
really
I don't
wanted to
like
see
I
how
don't like
this
your
was going to
voice.
play
It's
out.
very nasally.
Well, I do teach at a local university, and I've been teaching statistics for the past several years.
More coffee, Mr. Poon?
And Paul's got a great smile.
I love having him here.
Yeah. Oh, let me tell you, this is awesome. So, Paul, if you can hear us, best thing to do will be just to hit the refresh button on your web browser.
Oh,
and
he's gone.
He's moving.
Okay, he'll be back,
in just a second.
Yeah.
So anyhow,
the wonders of the internet.
You know, in all honesty, guys, it's been a while since we've had a lot of technical difficulties. Remember, for the first 6 months, every single show.
That was a big thing. Sorry,
Agreed.
It was.
Remember,
It was
Susan Gunn was like the Blair Witch Project.
Oh yeah, that wasn't that.
Well, it was all the platform that we were on, and we moved on to greener pastures.
Hey, real quick, I walked up to Susan Gunn at Chicago.
You did?
Do you remember me? And she goes, I'm so sorry, I don't. And I go, wee wee. And she's like, oh my God, it's a dink. It was so funny. Remember that?
You swear that really happened?
Chad goes, you know what this is? And I'm like, yes.
That's so funny.
Yeah, it was great. She was like, I don't know what the hell was going on with my internet that night. We had a great conversation with her.
She's so great.
What else can we bring up while we're waiting on Paul to come back?
So I want to tell you guys a little bit about my trip to Italy, where I got to visit the Deca Laser Factory, and saw some amazing technology. I had no idea. Not only does their parent company make CO2 lasers, soft tissue lasers for the medical and dental industry, they also make a lot of sculpting, like magnetic equipment. They make thermal equipment. They make so much neat stuff for the medical community that we're not even aware of. And the way that they innovate, they make everything right there. We got a full tour and got to see how they put together the the tubes to energize the CO2 for the lasers. And it was just an amazing experience. And they're like one of the only companies that make all of the lasers that they sell. So they can stand behind them in a way that almost no one else can, because they're in control of all of the manufacturing there. They've got some really cool stuff coming down the pipe. We were actually looking at Fraxel laser. We were also looking at their new ND-YAG offering. So lots of cool stuff coming down the pike. But we got Paul back.
Yes.
So
Paul,
let's bring him up.
I don't know what happened. I lost internet.
You didn't pay your internet bill. Just face it.
Are you in South Carolina, Paul?
No, I'm near Scottsdale, Arizona.
Okay.
He also
That's
said
usually
that
a
because
Jeff
his
problem,
internet
not
sucks.
a Paul problem.
So where we were,
all right, we're back to you being a professor.
You were talking about York Road. You live on the north side of town. I live on the south side of town. And
That's right.
You were about to ask me a question, so I'll let you carry on.
Okay, so Chad, tell me, what brings you into the practice today? How can I help you?
Well, Paul, Dr. Homoly, I apologize. My front teeth have just been really bothersome. I had some fillings done several years ago. They're picking up stain. I'm a little bit self-conscious about it. My wife says it's okay. The students don't really notice it, but I'm thinking about getting in the workforce, and I really would.
Okay, you're giving me too much information.
Oh,
just say, I don't like my teeth. Let me bring it out in you. Okay.
I just don't like the way that they look.
Okay, I understand. Now, your teeth, is this a problem more for you at work or at home? Tell me, how does this get in your way?
I don't know that it gets in anybody else's way, but it gets in my way because I notice it every time I look in the mirror. And so it bothers me maybe more than anybody else.
Okay, I see here, and I'm looking at your record. I see you're a university professor.
Yes, statistics.
All right, statistics. How long you been at the school?
7 years.
7 years. Is that something you're planning to stay with? Is that a long-term commitment for you?
Well, if I get tenure, yes, but probably not. I think I
Okay,
might go elsewhere, and I'm actually looking elsewhere.
okay. Does that have something to do with your decision to come in here today?
Yes, if I'm going to start the interviewing process, I think that it may be noticeable to others.
Okay, sure. I have a lot of patients who come in who are entrepreneurs or salespeople or entertainers, and they feel that their appearance could be really improved by doing something with their teeth. So I understand. So, other than your front teeth, Chad, is there anything else that's concerning you?
Not really. It's just really an appearance issue, and I'd like to improve that.
Okay. Is your wife, does she work at the university too?
No, she's a stay-at-home mom. We just had two twins.
Oh, you did. You did. Wow. Well, my kids are off the payroll. That train has left my station for a long time ago. So I'm curious about something. It's your front teeth. You really don't have any other concerns. Um, and you said it's been a while since you've been to the dentist, Chad. Tell me, why now? What's going on now that makes this important for you?
Well, I guess I wasn't perfectly clear. I'm thinking about branching out of academia, and I am looking into other opportunities, and I know that I'm going to have to be in front of the people. So I would just like an appearance that's more appealing to others as well as myself.
Okay, I understand. Let's do this then, Chad. Let me bring you in back. Let me introduce you to our team. You'll really like the team here. And let's see what we can do about getting you really confident in your appearance. How's that sound?
That sounds like a winning plan.
Okay, let's just stop the role play right there. Now, what I just did is I discovered the four chiefs. Okay, the chief condition was his darkened front teeth. But what's Chad's disability? How does that get in his way?
His lack of confidence going
Yeah.
into the new job opportunity.
Absolutely. And so once you know the disability, then you automatically know the behavioral benefit, which is what? What's the behavioral benefit he seeks?
Confidence.
Confidence, especially going into the new job. You see, when you can get more specific with the behavioral benefit, then it seems less generic and more honest. What's a significant fit issue going on in his life? A fit issue meaning a life circumstance. What is it that we need to think about? What is Chad going to be thinking about in his decision to accept this type of dentistry?
The cost of raising the children versus the cost of fixing my teeth.
Absolutely. He's got a stay-at-home spouse. He's a single earner. He's going to be leaving his job, seeking a new job, the dental expense. There's a lot of things that are going on here in this very short conversation. Okay. What did we learn? One of the things that is really key, especially with patients with chronic conditions, missing teeth, orthodontic issues, airway issues, longstanding cosmetic issues. When patients present with chronic issues, or when they say, boy, it's been a while since I've been to the dentist, what did I ask? Once it became obvious to me that Chad hadn't been to the dentist in a while, what question did I ask him that was really pivotal in our conversation? Do you remember that?
Yeah, it was why uh, you asked me why I hadn't been to the dentist in a
What
while.
Yeah.
what made him come to you today?
Yeah,
Yes. It's
What
called the why now question.
right.
yeah.
Okay. Why now? I mean, I'm looking at your record here, Chad. It's been a couple of years. Why now? What makes dental care important for you now? And that will reveal, number one, an upcoming life event, or
Mhm.
number two, a change in his personal fit issues. The fit issues are his life circumstances, or Both. So when you see a patient with chronic conditions, after you get to know them a little bit, don't ask the why now question too soon because it's kind of personal.
Mhm.
What you want to do is let the patient get to know you a little bit, get and understand the patient a little bit more. Then near the end of the conversation, so you say it's been a while. Why not? What's going on now that's important? And typically what you'll hear is an upcoming life event or a change in fit issue or something or both. Does that make sense, everybody?
Absolutely.
It does. And Paul, I have to ask a question right here because, I'm kind of a personality profiler in my practice. And so where does that fit into your gauging these patients with the four chiefs? Some people are just going to give you the short, why now? I don't know. What's wrong with
Yeah,
your teeth? I don't know. And
absolutely.
so how do you fit that into
Great
your
question,
four
Chad.
chiefs?
Mhm.
You
Sorry.
know, I used to get into the disc profiling and all of that personality. Is this patient a driver? Are they a socializer? Are they an analytic? And the more I tried to figure them out, the less authentic I felt. Okay.
But you've got a gift that I think that some people don't. You have the gift to perceive that rather than analyze that. And so I think that's
Yes.
where and
Yeah.
and and that's where I feel that my gift is that I can kind of perceive that rather than analyze it. So none of that stuff means a lot to me. But I think that we have to take that into account, and you have to gauge people based upon their initial responses as well.
Sure. And if a patient isn't forthcoming, then I just move on. I just move on. If I say, well, how can I help you today? Well, I don't know. I haven't been to the dentist in a long time. Really? Why now? I don't know. My wife sent me in here. I
Yeah.
understand. And I'll just move on. However, remember the focus of this conversation is about a patient, is about evolving out of tooth care dentistry more into the complex care dentistry. Typically, the patients are going to be older. Typically, the patients are much more vigorous healthcare consumers. They go to their cardiologist, their podiatrist, their urologist, the chiropractor. They're older, they're over 50. We're more savvy healthcare providers. Patients with significant dental problems want the dentistry, it's personal for them.
Mhm.
They want it to be personal to you too. And so by allowing the patient to get to know me a little bit, I talk about my kids. My kids are off the payroll. What I'm doing here, Chad, is I'm trying to keep you in the role of person and not put you in the role of patient.
Mhm. And
And go ahead.
no, I was just gonna say, what's your biggest tip that you could give for the non-communicative patient? The one that just is just so clammed down.
Let's do it. Okay. You just clam down. Okay. Let's repeat the exercise.
I love it. Let's do it.
Okay. Um, Chad, I'm Dr. Paul Homoly. Welcome to the practice. How can I help you today?
I don't like my teeth.
Oh, wow. I'm sorry to hear that. How long have you not liked your teeth?
I don't know.
Okay. Did you like them yesterday?
No.
Okay. Okay. Is there anything going on for you right now that makes dental care important for you?
Not really. My wife just told me to come in.
Okay, I see. Most of my patients are concerned about the cost of care. Is that something that you're concerned about?
Yeah.
Okay. Well, what we'll do is after we do a good exam, we'll sit down and we'll talk about the cost of care and see how that would fit into your budget. Would that be okay?
Sure.
I'm done.
Yeah.
Okay. Because
And so
Jay doesn't want to talk. If he doesn't want to talk, I don't want to talk.
that may be my fault as a practitioner. I try and find the common
We
denominator.
try and break them down.
I try and find the common denominator in every single patient. I'll at that point in time, I'll look at, I'll look at you, Paul, and be like, oh, you're wearing a polo shirt with a colored pony. I've always wanted one of those. I always try and find something to just bring something out of them. And I find that it usually works, but there's going to be those people that you're just like, you just leave the room and you're like, oh my gosh, I want to pull every hair out my head because they wouldn't give me anything.
Yeah. Well, you know what? There's always the outliers.
Yeah.
And there's some people that aren't going to talk, and there's nothing you can do about it. And I would say if there was a secret sauce to all of this, it's not about being a communicator. It's not about being a speaker, but it's about being a really, really good listener.
Yeah.
And being curious. I want to be curious about what is it about your teeth that's bothering you. I want to be curious about, if it wasn't bothering you, what lifestyle benefit would that bring to you? I want to be curious about, how does this need to fit into your life? Is this something that we need to do now or later or a little bit at a time? You see, I'm going to have certain pivotal questions that are going to go into this, and then I'm going to listen very carefully. All right, now we're going to do the exam. Okay, we're going to do the exam. During the exam, I notice, yes, you've got a lot of discolored composites across your maxillary anterior teeth. You also have 4 and 6 millimeter periodontal pockets in your posterior teeth, and you're missing all your upper and lower first molars.
Of course he is.
Okay, you got it? Okay, classic. Chewing on his front teeth, breaking his front teeth down and stuff like that. Now, after the exam, I'm going to do what I call the post-exam discussion. You're still in the chair, Chad. Okay, you're still in the chair. Okay, now I sit the chair up, and now I'm going to talk to you. You ready?
Yes.
Chad, I've had a good chance to look at your teeth and study your x-rays. And I see a lot of good things about your teeth. When I examine a patient, we look for a variety of things. We really start with the general overall relationship of the upper and the lower teeth. And in your case, it's pretty good. When I evaluated your x-rays, I looked at the density of the bone. I didn't see anything that was bothersome. I didn't see any cysts. I didn't see any evidence of prior infection. When I looked at the soft tissues of the mouth are the gums and the tongue and the palate and all those areas. About 5% of all cancer occurs in the mouth, and I saw no evidence of that. Your soft tissue not associated with your teeth is actually pretty healthy. And one of the most important things about your dental health is that your medical history looks pretty clear. I see you've got a sensitivity to Demerol. A lot of patients have that. But one of the most important things about good dental health is good medical health. So overall, you're in pretty good shape. Now, I know that you're concerned about the appearance of the front teeth. I've got a lot of patients who have old fillings like yours, and they find that over time, if they don't do anything about it, the fillings just continue to darken. And I know that's your prime reason for being here. I also noticed that did you know that you had some low-grade gum infection in your back teeth? Did you know that, Chad?
Thought I had some pyorrhea, but I wasn't sure.
Okay. A lot of patients are unaware of that. Typically, we find that when a patient's been away from a dentist for a while, that the gum infection can lead to severe mouth odor. It can cause some patients, the bone around their teeth, to die. Is this something you're concerned about, Chad? Is this something you'd like to talk to me more about?
Well, I really didn't think much about it until you mentioned it. But
Okay.
now, yes.
Okay. Last thing I want to talk to you about is the missing teeth. I'm sure you're aware that you're missing your. How did you lose those teeth?
I really don't remember.
Okay. I had some wisdom teeth taken out when I was in the Navy. The Navy dentists are quick to take out wisdom teeth. Let me tell you the problem with missing teeth. Typically, when I see missing teeth, the teeth around the spaces kind of drift in. Teeth move slowly like glaciers. And one of the problems with missing teeth is it causes the relationship in the bite to change. One of the prime reasons for tooth loss is tooth loss. Missing teeth cause other teeth to be lost. Is that something that you're concerned about?
Now that you mention it, yes, it is something that I'm concerned about.
Okay, let me do this. Let me go in back. I'm going to put together a care plan for you, and I'll be back in a few minutes. Let me stop right now. Okay, what did I just do? I made you, number one, aware of all your conditions. Number two, I stated the consequences of those conditions if left untreated in patients similar to you.
Mhm.
See, I didn't threaten you with your condition. I didn't say you were going to lose teeth. I didn't say your infection was going to get worse. I said patients like you. Okay. So, one, I made you aware. Number two, I gave you the consequences of those conditions if left untreated. And number three, I asked you whether you were concerned about those conditions. And for each condition I mentioned, you said you were concerned. Okay. But
You provided everything in a positive manner, and you brought me into the conversation.
that's right. And how did I start the conversation with you?
Well, basically, did you know, and does it concern you?
Yeah. Well, actually, before that, I said you got a lot of good things about your mouth.
Oh, of course. Yeah, you were you went,
Sandwich.
what do they
Yes.
call that? Kiss, kiss, kick, or something like
No,
that?
the sandwich technique.
Yeah.
Yeah.
You were. I was noticing that in the beginning. You were, and that's exactly what I try and do. My treatment plan presentations bring out all of the positive, and then I mean, and it was.
And
I
then
was
wow.
Congratulations, you woke up today.
Yes. Exactly. And I call that positive.
Sometimes that's all you have. You're
above
vertical.
ground. Yeah.
That's right. And I call that positive framing. So the post-exam discussion, especially, Chad, for the complex care adult patient, right? Chad's not a happy guy. He's not happy about his teeth. He's got missing teeth. He's got a lot on his plate right now. I need to give him a big dose of good news. I need to create a positive emotional momentum going into my conversation. So I want to start with the good things about his teeth. Yes.
I'm sorry. We're actually starting to run short on time. We're getting close to 9:30. So
Okay.
what I don't want to miss is I mean, this is amazing stuff. I mean, just what we did in those.
I had no idea what time it is. Yeah.
He's
we
so
all
excited.
forgot what time it was, but just in those interactions and the role playing, I mean, really, we've learned an incredible amount. I think what everyone out there wants to know is how can they learn more about case presentation and getting patients to say yes in the dental chair?
Yeah, a couple ways. Number one, go to my website, www.paulhomoly.com. Go there and click through. It's on my homepage. It's called Treatment Acceptance Mastery. And it's online programs. It's a curriculum program based on my books and all sorts of experiences working with dental offices. It's a great place to start, called Treatment Acceptance Mastery. And I mentioned to you earlier about that initial conversation with patients. A lot of dentists will tell me, Jeff, well, I don't have time to do that. Well, there's a very specific scheduling technique. And if your listeners would text, pick up your phones right now and text to the address 55444. Text the word schedule. Text 55444 and text the keyword is schedule. And what they'll get, Jeff, is they'll get a job aid, they'll get a process chart to show how to identify complex care adult patients on the phone so you can appoint them first thing in the morning, first thing in the afternoon, so you've got the time to have this conversation.
So, I mean, this is incredible information. And for everyone out there, the reason I knew a lot of the answers to what you were asking is because I followed you for a long time and you've had an amazing impact on the case acceptance in my practice. And literally, there's not a lecture that I do where I don't mention your name and say, and we've never met personally
No,
other
we
than
haven't. Yeah.
me just sitting in your courses, but there's never a course that I do that I don't mention, seeking out your knowledge for case acceptance, because there's really nothing that has done more in my practice than one, learning that I have to understand where my patient is coming from, and two, from a dental perspective, figuring out the information that I need to help my patients make the right decision and not overcomplicate the case presentations,
You bet.
which is a big summary. But Paul, we would love to have you back.
Please.
Maybe do a part 2 if you'd be open to that.
Sure.
Yeah, we'd love
Yeah.
to. But
Paul,
I
I'm a
want to say
tough
thank you,
customer.
and thank you for everything you've done for my practice over the years.
Paul, I'm a
Outstanding.
tough customer. I was in a trance. I had no idea what time it was. I mean, I was so enjoying that. Thank you so very much for the time that you spent with the role play and everything. It was amazing. Truly, truly amazing. I feel like we only got halfway through it. We have to have a part 2.
Yeah.
Yeah,
Well,
we'll have a part 2.
we'll do a part 2. In part 2, what I'll do is now I'll present you care based on what you're concerned about and what you're not concerned about. And in it, I'll weave in your fit issues, your disabilities, and your behavioral benefit. All of it will come together. And I'll do it in less than 2 minutes.
You know what? What I'd like to do, I'm going to propose this to the group. Let's pick a time that's good for Paul. Let's do a recorded session and then let's air it. And then that way everybody can get the full Paul and whatever he needs, so that we're not running into bedtime and putting kids down time, because I had to get the twins to bed. I mean,
Outstanding. Okay, everybody. Well, then Jeff or JB, you guys just let me know when and
You got
where, and we'll roll with this. I'm so glad that you enjoyed it. And actually, when we couldn't put the slides up, I thought, let's just do some role playing. So Chad,
I
you were
love that.
terrific.
That was
Outstanding.
thank you. I appreciate it, Paul. I really was in a trance. I had no idea it was 9:30. I'm like, this is great. Give me more. So thank
Give me
you.
more.
Yeah,
Okay, guys.
when you said ignorant layperson, I mean, and you picked Chad right away. It was just perfect.
It was actually some of the most intelligent commentary he's had on the show thus far. So, Paul, for that, you are an amazing communicator.
Outstanding. Outstanding. Okay, everyone, one more time, text 55444, keyword schedule. You'll get that scheduling piece. You'll really enjoy it. Bye for now, everyone.
Bye.
Bye,
Okay.
Paul.
Good
Thank
night,
you
Paul.
so
Thank you.
much.